All right, everybody, let's go ahead and get started. My name is Rachel Taylor. I'm our Director of Nursing Services here at Archer. And today we're going to talk about one of the most important topics to me, which is test anxiety. So I'm super excited to hang out with you all over the next 30 minutes to go over this really important topic. So let me get my little, there we go, timer off the screen here. And I really want to talk about test anxiety because when it comes to the NCLEX, or maybe you're coming back after a previous attempt, it can feel like you're a little alone when it comes to test anxiety. But I want you to know that you're not alone. Every year, thousands of students struggle with test anxiety. It's not with content, but really it's with the confidence that comes with it. Really, when I think about test anxiety, it can cloud your thinking, it can drain your energy, and it kind of robs the opportunity for you to show truly the knowledge that you have. But the good news is it doesn't have to be this way. So today we're going to name the problem of test anxiety. We're going to understand kind of what's happening in your brain and in your body. And then most importantly, I'm going to make sure you understand what to do next so that you can really take control of this test anxiety. Because this is about so much more than passing an exam. This is about so much more than taking your NCLEX. It is about having this tool when you start practicing as a nurse. The reason this is so important to me is if you look at evidence, nurses leave the bedside at alarming numbers within the first 2 years. Why do I personally think that is? Because we haven't equipped nurses with the strategies to overcome anxiety in the workplace, to overcome self-doubt in the workplace, to give them the supports that they need in the workplace. And this is one of these aspects. So take a deep breath settle in and get ready. We're going to shift from stressed and stuck to calm and confident for your NCLEX prep. So let's go and talk about test anxiety. What is it? Let's name it. It's a performance stressor. And when it happens, your anxiety builds and builds and builds until you're in your fight or flight or freeze. So has anyone ever been in an exam and felt like, oh my goodness, I need to get out of here. I need to get out of this test. It needs to be done. Like the faster this test can go and I finish up, the better. Anyone ever have that feeling during their NCLEX? Okay, several people are like, yes. Or maybe it is that there shouldn't be any background music playing right now. Are you guys hearing background music? Let me know, but you shouldn't be hearing anything going on in the background. Okay, perfect. I'm seeing no, that people aren't hearing that. The other thing that you might feel during that exam is like you're stuck. Like, I don't know which answer to pick. I'm going back and forth. Is it C? Is it D? Is it C? Is it D? And you feel like you can't pick. You're kind of frozen in that question. Okay. And so what happens is you get into your fight, flight, or freeze. But what's the problem with that? You could not critically think and apply clinical judgment if you are stuck in your flight, fright, or in your flight, freeze, or fight. Okay. And so what I want you to do is I want you to start thinking about kind of what led to that feeling. And we're going to talk about this in a moment. But how I think of test anxiety is like I were to put on a backpack, and I live by the Black Hills in South Dakota. It's like I'm going to go do a hike up the hill. And everything that leads to my test anxiety is like putting a big rock in that backpack. And when I go to do that hike, the load starts to get really heavy. So I want you to reflect for a moment and put in the chat what causes your test anxiety. When you reflect on what are the things that cause you to get anxious when it comes to testing, what are those? Let me know. And this could be different for all of you. For me, it was the need for perfection and the fear of failure. Those were my two biggest stressors when I was a new grad and when I was taking my NCLEX exam. For some of you, it's failing. For others of you, it's about the timing. Maybe of the fear of failure is for a lot of you. You know what I find? We let the fear of failure hold us back from success. And imagine what happened if we let go of that fear of failure and we just did the best we could instead. And if for you, it's that need for perfection, the standard in nursing was never meant to be perfection. It was meant to be excellence. And along the way, we've gotten the two confused. And instead, we need to focus on how do I work to be excellent? What do I do when I don't know? What do I do when I get the answer wrong? Because let me tell you guys, it's going to happen. You're going to get the answer wrong. You're going to make mistakes as a new grad. But if you beat yourself up over it, you are never going to be able to reach your full potential. But instead, if you say, okay, I made this mistake, but here's what I'm going to do next time to fix it. You own the mistake. You own the knowledge gap. You fill the gap and you move on. Guess what happens? You reach higher potentials every single time. And let me tell you, this doesn't just help you when you are in, taking the NCLEX. It helps you as a new grad nurse. It helps you in any skill or job that you want to do. So I really understand what it can feel like to have that fear of failure, but know that you are capable. And if you're a repeat test taker, so many people pass on their second attempt, their third attempt. I once had a student pass after graduating 30 years prior. I've had people in their 60s go and take the NCLEX and pass. I've had people after a cancer diagnosis and treatment go and pass their NCLEX. And the reason I share that is if they have done it, you can do it too. Is it easy? Is it going to be a walk in the park? No. But are you capable? Yes. For anyone, is it, maybe that others depend on you, and maybe it's like you've got a family member who keeps asking, when are you going to take your test? When are you going to take your test? How's it going? Yeah, a couple of you are like, yes. Remember your why. Why are you doing this? Why do you want to become a nurse? and let that fuel you. Don't let anyone else stress you out over it. Don't let anyone else push you into feeling like you're behind. Because what happens is we start to do this comparison game. Anyone ever compare yourself to your classmate, to other nurses who are maybe younger than you and they're much further already? Comparison, it is the thief of joy. It is going to make us feel like we're behind. But in reality, your journey is your own. Okay? Your journey is whatever, you want to make it. You've overcome things that other people haven't. We all are started with different cards. We're all dealt a different hand. And it's about what you do next. It's about what you decide to do next, but you're not behind. You're right on time, even if that journey looks different than somebody else, because it's yours and you've done things differently than others. But what I would tell you is I'd rather you do it today than never do it at all because you were too worried about someone else being ahead of you. And what happens is you're going to be able to reach further potential the more you focus on that. Now, for others of you, is anyone worried about a job offer? Anyone stressed out about the job offer? Yeah, you're right. Everyone's journey is different. Love that. Okay, some of you are like, yes, I have a job offer. I got the perfect job offer. For me, I always wanted to work in the ICU. That was my number one thing I wanted to do. I got a job offer in the ICU, but offers typically are in alignment with if you pass your NCLEX. Now, some jobs say the first time, others don't clarify. And I've seen students lose their job offer if they don't pass their NCLEX the first time. Do not let that hang over you. Do not let that add anxiety to you. Because what I will tell you is, one, as a nurse, you can get so many jobs. I promise you there's a ton of jobs out there. But two, you're not taking this test for that job. You're not taking the NCLEX and becoming a nurse for that one singular job. Let me tell you, I started off in the ICU. I worked with veterans for a while, and then I somehow randomly, accidentally got into education and absolutely loved it and have fallen in love with being an educator. So your journey from when you graduate is going to look different 5 years later. And it's going to go in different directions, probably than you ever expected. So don't get stuck on, oh, I have to have this one job. Take the test, do the best you can, and that job's going to be there when you do. All right, so let's kind of go into prevention of test anxiety. I hope that was helpful. I know I went on a little rant there, but I hope it was helpful to kind of understand, because I've seen this impact thousands of students, guys. I've been an educator for 5 years. Test anxiety impacted me deeply as a student to the point I had really bad self-doubt. I would like full on sweat during tests. It's really embarrassing, but I would be like red, like the color of my water here, my fruit water. I would be like that color and like sweat during tests because my anxiety was so bad. So how do we prevent test anxiety? Number one, I don't expect it to go away if you are someone that struggles with it. I expect you to have some test anxiety. A mild amount is okay. And I want you to know what your earliest signs and symptoms of test anxiety are. Because if you address it when it's lower, that's going to help you stay out of your fight, flight, or freeze. The other thing is when you feel confident, your test anxiety is lower. Who would agree with me that when you lack confidence, your test anxiety is higher? Who would agree with me on that? Anyone agree with that statement? Yeah, when that confidence is lacking, our test anxiety is higher. So what do? We build our confidence. Now, how do we do that? Well, if you are prepping for the NCLEX, my goal for you would be to get 4 highs or very highs consecutively in the Archer platform and to complete 80% of our Q bank. Students who do that have a 99% chance of passing their NCLEX. And I don't know about you, but 99%, those odds are pretty good. So that would be my recommendation because it boosts your confidence. We have over 800,000 nurses use us at this point. So it's like, okay, I know if I meet this benchmark, my chance of passing is very high. And then make sure you know how exam day is going to work. They pat you down. They make you do like this palm vein scan. There's going to be several things that they do to make sure that you're all checked in correctly. And I don't want that to cause anxiety to you. So I want to ask you, what are your earliest indicators of test anxiety? So I told you guys I get really red, get really sweaty. I also feel like my heart kind of starts to pound pretty quick. But what is it for you all? What are those earliest indicators of test anxiety? Let me know. Headache, wanting to cry. Yeah, there can be an emotional response. Absolutely. Tachycardia, sweating. I'm glad I'm not the only one that sweats. I know it's not the most enjoyable thing. Being really thirsty, feeling chest pain, feeling anxiety. Absolutely. Now, who would agree with me that society has kind of taught us when you have anxiety, you're just going to push through it and everything will be better? Would anyone agree with me that that is what we have been taught to do as just human beings? Push through and it'll be fine. Anyone agree with that? Okay, a lot of people saying yes. I want you to do the opposite of what you've been taught or what you feel is natural. I do not want you to just push through it, because if you do, your anxiety builds and builds and builds and builds to now you are in your fight, flight, or freeze. So to prevent that, when it's down here, we pause, we stop, and we use our anxiety toolkit. So I want to know, to this point, what do you do? I know what we talked about, what society does, but what do you do to this point? Do you push through your test anxiety, or do you pause? Do you give yourself a minute and then come back to the questions? Let me know. Okay, take a deep breath. Good. A lot of you are like, yeah, I pushed through it. So as soon as you feel it, these are the tools that I like to use. Number one is positive self-talk. We'll go through this more in a moment, but mindset does a lot more for us than we realize. We're going to do some deep breathing. We're going to cause our vagus nerve to be kind of induced, so that way it tells our body, okay, I'm safe. I can go into my rest and digest. There's a couple strategies to get there. We're going to release our tension, and we'll use what's called the 3-2-1 rule. So let's look at this a little bit further. Number one is positive self-talk. And this is our inner monologue that makes us feel good about ourselves. But who here, when they get a question wrong, says, oh my goodness, how did I miss this question? How did I get this concept wrong? It was so easy. Anyone do that? Maybe start to have a bad attitude, like, I'm never going to get there. I'm never going to reach this. Oh, I'm just not good enough. Maybe I'm not going to make it as a nurse. Anyone ever do that? Instead, imagine the impact if you said, I missed that one, but that's okay. I'm going to figure it out. Here's the key NCLEX concept that I missed. Imagine if we changed that mindset. On it, instead of us making a mistake and putting ourselves down, this is again something we're taught in society. Instead, we lift ourselves up. I want you to talk to yourself how you would talk to your best friend, your child, your parent, your significant other. How would you motivate them? Because I guarantee you, it's not saying, oh, you're never going to figure it out. Oh, you're never going to get these questions right. Oh, you're never going to make it. That's not how we would talk to our best friend. We would say, you are worthy, you are capable. Yes, this is hard, but keep showing up anyway. Keep working hard every single day, because even if your path doesn't look how you wanted, you are going to get there. And imagine the difference it will make in your testing ability when you change that mindset. And I want you to start that now. This isn't something you just start when you go take the NCLEX. You start it now and you keep implementing it. You keep changing that mindset day by day. And is it easy? No. Guys, I teach on this and it's something I still struggle with. Our mind can really bring us to negative places, and we have to be mindful of that and replace it with positive thought. And I promise, when you start doing this, you become more capable of more than you ever imagined you could be. Now, the next thing that we can do is deep breathing. So there's several different options for deep breathing. I'm going to demo what I do. I know I'm going to look goofy, but it's fine. I just close my eyes. I take a deep breath in and I let it out. There's no reason for the hands. I'm just going to tell you, there's no science behind the hands. But I'm going to do it again. Close my eyes. Take a deep breath in, hold it. Deep breath out. You have to do it down into your belly. It puts pressure on your vagus nerve. It will remove you from your fight or flight. It tells the body, I'm okay. And it allows you to go into your rest and digest, bringing your heart rate down, telling yourself, I'm safe, right? Because my body doesn't understand the difference of me being in a stressful situation with a test and a moose coming through, and that this would never happen, a moose coming through my window, and me needing to run from said moose because I might get attacked by a moose. I don't know if a moose would do that, right? But my body doesn't know the difference. It just knows I'm in my fight or flight. And so this is how we kind of prevent it. Now, if that doesn't work, if any of you all did choir, what I want you to do is go, oh, 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 oh. What you're going to notice is after you do it 5 times, it's really easy to take a yawn. If you do it at least 5 times, and you can't just say, oh, you have to do it like this. Oh, if you did choir. What that does is it forces a yawn. If you can force a yawn or get a yawn out, it also tells your body, I am safe, right? Like if I'm running from a moose that's trying to attack me because it breaks in my window, I'm not going to be yawning, right? But if we allow ourselves to yawn, it tells the body, I am safe. And then it allows you to be able to critically think again. Typically with the deep breaths or the yawns to try to get or the O's to try to get a yawn, typically if you repeat it 3 times, that's enough to get you out of your fight or flight. The other thing is you've maybe noticed when you've had a really stressful day, you hold a lot of tension in your shoulders and in your back. If you kind of notice that, I want you just to tense up, relax, tense up and relax. And when you let that out, it's just letting out that pressure in your shoulders. And then lastly, if nothing else is working, that's when you do the 3, 2, 1 rule. 3 things you see. So for example, right now, I see a pen on my desk. I always have several. They end up in several places. I also have my phone on my desk. I always have my phone out in case someone needs me from my team. And then I typically always have water next to me. So those are 3 things I see. 2 things I hear, myself talking, which let me tell you, no one likes listening to themselves talk. And my computer fan is so loud. I hope you all can't hear it, but my computer fan is super loud. So that's the other thing I hear. And then one thing I can touch or smell, I can touch the desk in front of me. Now, I'm curious to hear, what are some other strategies you maybe have used for test anxiety? So I'm just going to give you guys a moment to plug this in the chat. I'm curious to hear from you guys, or what are some other strategies that you've used in the past? Anyone have any other strategies they'd like to share? A stress ball, that's great, especially when you're studying at home, maybe practicing, that's a great option. Absolutely. Meditation is really good. Deep breathing, that's perfect. Rubbing the side of your temple. I do this a lot. Okay, seeking a psychiatrist. I love that. If your anxiety is really high, go see your primary. Like if you are struggling day to day with it, absolutely go see your primary. Chewing gum. Reagan, I do the same thing. I used to every test chew 2 pieces of gum. It had to be 2. I don't know why, but absolutely. Yeah, talking it out. Let me tell you, I told you guys earlier, our mind can do a lot of things. And really what can happen is we start to make the scenario almost worse. But when we talk it out, it's like, oh, that's not so bad, right? It's not so bad. Moving your body is huge. Journaling can be helpful. I'll be honest, journaling is something I've started probably 20 times in my life. I never do it more than 5 days. And I'm like, oh, I'm all done. Meditation is a really good one. And then socializing, communicating with one another. And that's why it's helpful to have people who are going through similar things, other people that are studying for their NCLEX exam or are in nursing school, because when you talk with them about it, they're probably going through a lot of the same things, and it can make you feel not alone. Now, if you're going to take your NCLEX, just some general tips here is I want you to keep each question to 2 minutes or less. I want you to trust your gut, trust your instinct, and to not change your answer. The biggest piece of advice I have is don't start to self-evaluate. Anyone ever count the number of items they think they got right or wrong on a test? Like, oh, I got my tally. I got 10 things I think I got right and probably 10 things I think I got wrong. That's never helped anyone. That's never made anyone feel more confident. Typically, students that do that, they'll email me after they take their test and they're like, Rachel, I don't think I passed. And so what it does is it starts to lead to self-doubt and makes you really know what that question is asking you. So from all the strategies that we talked about, which method are you going to try? Which method are you like, this is what I want to do? Try maybe differently when it comes to your test anxiety. And you don't need to put it in a chat, but just think through that for a moment. And remember, you don't have to know it all. You're probably thinking, wait, I don't? But the answer is the NCLEX is designed to test your readiness to begin practice as an entry-level nurse within the first 12 months. It's really important to remember that the NCLEX is not an assessment of your value as a person, your value as a nurse. It's just saying, hey, are they going to be safe in their first 12 months of practice? And so I totally understand the reality of test anxiety, but you do not need to know every single question. If I were to take the NCLEX tomorrow, I would probably get questions I don't know the answer to. And guys, I've been a nurse educator for 5 years and a nurse longer than that, which tells me that you don't have to be perfect either. It's about what you do when you don't know the answer. It's about making sure that when you don't know the answer, you say, okay, these are the answers I got it down to. I'm going to choose my best guess and I'm going to move it on. Because remember, we cannot put ourselves to where we're trying to achieve perfection, but where instead we achieve to do the best we can. And if you can do the best you can on every question, imagine how well you're going to do at the end of that. Now, as we kind of close our session on managing anxiety for your NCLEX, I do want to take a moment to reflect on this. Feeling anxious about the NCLEX, it just tells you that it's important to you. It's a reflection of, hey, I've been really committed to the profession of nursing. And what I want you to do is I want you to really channel this anxiety to be a driving force for you, to help you work harder, to help you be more strategic rather than a stumbling block for you. And let me tell you, you have control of that. You have control of what this looks like. And remember, Archer Review, we are here to help you. Guys, I have struggled with anxiety. I have seen countless of students struggle with anxiety. If you need some help, shoot me an email. My email is rachel.taylor@archerpulse.com, and I'm happy to help anytime. In Archer, we have the resources you need for it to be a one-stop shop for you to feel like, okay, I've got what I need. I've got the resources to be successful. And then the other thing that I want to remind you of is that you've got this. You guys can do hard things. You're going to do amazing things with your careers. I know that sometimes the journey isn't as straight as we would like it to be, that sometimes it goes in different directions, but know that you are capable, you are worthy, and that you can do this if you set your mind to it. The biggest thing that I see is those that are consistent are successful. Yeah, I'll say my email one more time. It's rachel.taylor. So if you look at my name on the screen in Zoom, or if you're on the other social channels, I don't think it shows it on TikTok, but rachel.taylor and then @archerpulse.com. I'll put it in the Zoom chat since that's where I see someone is needing it. Okay. And then let's see. Someone said I have my exam for April 10th, but I'm not quite ready. What I would recommend doing is, it shows that you just did the free demo. What I would recommend doing, if you are an RN student and you're like, I only have a few days, we have an exit exam. I would go buy the exit exam. If you do not get a high or above on that exit exam, I would not take your NCLEX that quickly. I would push your exam back. I would do Sure Pass combo, and I would follow the 6-week study plan. Here's what I want to remind all of you of before we go. When you are prepping for your NCLEX, okay, when you're prepping for the exam, what I want to remind you of is we can do things really quickly. We can do them short and not do it to the best of our ability. And then it's like we go take it and we're not successful. And we're like, why have I not been successful? I've worked with thousands of repeat test takers. I kind of specialize in that area. I specialize in students that have been years since they graduated. And what I find is once they're consistent, they explain the concepts out loud using our program, that they go on to be successful. I've seen students who didn't think they could be successful find success with Archer. And so I do feel confident in the product, but you have to use the product to its fullest. But if you have questions about it, you're not sure, let me know. You can always reach out to me via email. We do offer private tutoring. So if you're like, this was helpful, like chatting through it, even though I know I'm not one-to-one with you all, we do have one-to-one. Our tutors are amazing. Carly B and Lance are two of our tutors that are just incredible. So I would definitely consider doing tutoring and adding that in. If you're like, I'm not reaching the 4 highs or very highs consecutively on Archer, that is where I would add in that tutoring, or if you're really lacking confidence. Someone said, I have a question. I'm getting passed on CAT, but not highs on assessments. Can I go with this? If you are passing your CATs, but not getting highs on assessments, it tells me that you have a content knowledge gap or a testing strategy gap. I would work with a tutor in that situation. Like those are times where I recommend working with tutors. Not everyone needs one, but there are strategic times that it is really going to make a big difference on if you do have one. Let me know if you guys have any questions, reach out via email, but it was so glad. I'm so glad to have you all here today. And I do just want to remind you all that Archer is here across the lifespan. And I have just one last kind of thing I want to share. Anxiety is not a reflection of your ability. It's a response to the pressure. It's a response to caring about something. And that's something we can all learn to manage. You've spent years at this point, for most of you, studying for the NCLEX, learning how to be a nurse, practicing in clinical. And remember that this test, it doesn't define you, but managing your mindset can absolutely change the outcome. I'm rooting for each and every one of you. I can't wait to hear how you're successful. And if you have any bumps in the journey, if you need anything, please reach out to me or someone on our team. Our email for our nursing team is nursing@archerpulse.com. We would love to help you and support you. We want each and every one of you to join us in that nursing profession. Being a nurse is one of the greatest things I've gotten to do. And I can't wait to have you all join me in that profession. I hope you all have a great weekend as we head into Friday tomorrow.